Heart failure in dogs and cats. For the heart examination basics, the key concepts are palpable fremitus, auscultation sites such as intercostal space 3 to 6, and Frida for sound assessment. The valve oscillation points are pulmonary on the left at intercostal space 3, aortic on the left at intercostal space 4, and mitral on the left at intercostal space 5. Heartbeat strength can be altered by exercise, hypertrophy, and fluid or disease. In heart failure, look at the clinical aspects, and then the definition is insufficient cardiac output to meet metabolic demands. The pathophysiology is stroke volume is affected by preload and afterload and contractility. The Frank-Starling law means the stretch affects the contraction. Overstretch leads to congestion. Concentric hypertrophy means pressure overload, and eccentric hypertrophy means volume overload. The types of heart failure are left-sided, which is pulmonary edema and congestion, and right-sided heart failure, with its hepatomegaly, ascites, and jugular distension. The signs are pale or cyanotic mucosa, capillary refill time less than 2, fatigue, tachycardia, and cachexia. And for compensation, we have the renin-angiotensin system and inflammatory mediators such as TNFA, IL-3, IL-6, and for the treatment of heart failure, we have chronic therapy, and the goals are to reduce preload and afterload and increase contractility and manage renin-angiotensin system. And the drugs we use are diuretics such as furosemide and spironolactone, pimobendan, and ACE inhibitors such as enalapril. For diet, we give high-quality protein, supplements such as potassium, magnesium, and vitamin B, and omega-3s and taurine. In the case of emergency therapy, in acute congestive heart failure, we use oxygen, furosemide, pimobendan, and sedation.